As a small or medium-sized healthcare provider, much of the electronic protected health information, EPHI, you maintain or send to others is critical to your business and vital to the care of your patients. Lost or stolen laptops, identity theft, malfunctioning computers, and hackers are just a few of the potential risks you face as you receive, store, and transmit health data in electronic form. Healthcare providers face major problems if their patient's EPHI is stolen, lost, or misused, or if it is incorrect or unavailable. A well-planned security management process can help your organization make timely risk decisions. The security management process is your organization's strategy for handling risks, and a complete, properly conducted risk analysis is the first step to a thorough security management process. To make sure that organizations take steps to protect EPHI, the U.S. Department of Health and Human Services, HHS, issued the HIPAA security rule. This rule helps covered entities and their service providers, including small and medium-sized providers like you, to guard against and react to security incidents. Although there are many elements that make up the HIPAA security rule, a risk analysis is seen as one of the most important. Performing a risk analysis will help you identify when and where there is a risk that someone can compromise the confidentiality of your EPHI. Someone might inappropriately alter or delete your EPHI, which affects its integrity. Or, your EPHI might not be available when you need it. Another key requirement of the HIPAA security rule is that you establish security measures to reduce risks to a reasonable and appropriate level. While complete protection from risk isn't possible, taking these steps can help you to protect your EPHI against those risks that can be reasonably anticipated. Completing a risk analysis and correcting security deficiencies is also a core requirement for receiving Medicare and Medicaid EHR incentive payments. This incentive program, also called Meaningful Use, is intended to improve U.S. healthcare by giving providers and patients better access to complete health information through the meaningful use of electronic health records. In order to receive meaningful use payments, you must complete a risk analysis, correct identified security deficiencies, and attest that you have done so. Taking these steps to secure your patient's health information is not only required by HIPAA and the Meaningful Use program, they are also good business practices. Because you can complete a risk analysis using many different methods, we will describe the key elements that you must include in your risk analysis, regardless of the method you choose. The HIPAA security rule requires the scope of your risk analysis to include the potential risks and vulnerabilities to all the EPHI that your organization creates, receives, maintains, or transmits. This includes EPHI in all forms of electronic media, such as hard drives, laptops, backup tapes, smart cards, and other portable electronic media. It includes electronic information and information technology physically in your office or stored or accessed remotely. Your organization must gather information about where and how the EPHI is stored, received, maintained, or transmitted. Remember, EPHI can be more than a medical record. EPHI includes appointment information, billing information, and insurance claims information that have a designated record set, which is outlined in greater detail in the HIPAA regulations. You'll need to gather information on where EPHI may be stored, on computer workstations, laptops, copiers, mobile devices, in an electronic health record, CDs, smart cards, or any other portable electronic media. Think about where EPHI flows: to other physicians, to the patient, between providers in your practice, to a backup facility, or an off-site location. Also consider how the EPHI flows or is transmitted: via email, fax, shared network drives, direct exchange, or over a health information network or exchange. You can gather relevant data by reviewing past and/or current projects, interviewing your office staff or IT support staff, reviewing your policies and procedures, or other data collection methods. Once you have completed your data collection efforts, you must document your findings. Next, you will identify and document possible threats and vulnerabilities. Threats can be human, natural, or environmental, things like hackers, disgruntled employees, floods, natural disasters, or power outages. Vulnerabilities are weaknesses in your security controls, which could potentially cause a security incident. For example, unencrypted laptops may allow an unauthorized person to access EPHI. Other vulnerabilities can be inconsistently carrying out policies or procedures that are in place, or, worse, not having anything in place to safeguard physical access to computer workstations that handle EPHI. Next, you will assess your current security measures to safeguard EPHI. During this step, you will review the administrative, technical, and physical safeguards you have in place or have planned, and whether they are being implemented or used properly. From there, you should determine the likelihood that the threats you identified will occur. This will help you determine which threats the HIPAA security rule requires you to protect against because they are reasonably anticipated. You also need to determine the impact of potential threats on your practice's EPHI. If a threat actually occurs, how will it impact the confidentiality of your information? Will unauthorized people be able to access your EPHI? Will they be able to change your EPHI, compromising its integrity? If a threat, such as an electrical outage or severe storm occurs, will your organization's EPHI be available to you? You need to document all potential impacts associated with a threat to your EPHI actually occurring. You will then categorize the likelihood and impact of threats and vulnerabilities as high, medium, or low. Take a look at the sample risk level matrix on the screen. This table will help you determine your overall risk level. To determine your overall risk level, you can use the reference table to understand the average of the high, medium, or low values you assigned earlier. The risk levels you come up with will help you prioritize how to address the risks you have identified. Once you have assigned and documented your risk levels, you need to develop and document a list of corrective actions to mitigate your risks. You should take into account your organization's size, operations, and resources. Corrective actions could include putting a new policy in place and training your staff on this new process, or adding physical safeguards such as locks on doors. The final step you will need to complete is to review and update your risk analysis from time to time. The risk analysis process should be ongoing. Since your practice is constantly changing, we recommend that you perform an annual risk analysis. A variety of tools from healthit.gov and hhs.gov/OCR can help you complete the core elements of your risk analysis. We hope this video has opened your eyes to the importance of protecting and securing your EPHI. For more information on the topics that we've covered in this video, or to learn more about risk analysis, please visit the references outlined on your screen.